Hey, you guys. My name is Natasha Lund, and welcome back to the Eccentrics Being podcast. Whether you're listening from my podcast or watching from my YouTube channel, I got to thank each and every one of you guys for your love and support. And I also got to give a big thank you to God. All glory and honor goes to God. And if it wasn't for God, then I wouldn't even be here. I wouldn't even have these platforms to speak to you guys and reach out to you guys. So I thank you all. And I also want to dedicate these videos to my future husband, future kids, and future grands. And, I just want you guys to know that I love each and every one of you guys from the bottom of my heart. And I just pray that you come into the will of God, that you know what God has called for you to do and be what God has called for you to be in this time and season of your life. And also to those that are watching and listening, I pray that the will of God and the purpose of God will be known in your life as well, like He made it known in mine. And so if you're new to my channel or podcast, for you guys who may not know, I am a certified life coach. In addition to being a certified life coach, I am also, I would say, a social media creator. I do YouTube, I do Anchor or podcasts, and I'm also a registered nurse. So God has blessed me with being able to add that to my profile. But today's topic is going to be about nursing. It's a nursing topic, and it can also be a topic that's related to just life in general. So the topic here today is HIV/AIDS. So I did a podcast regarding the HIV/AIDS, and it was kind of more so like a nursing NCLEX style, I would say like a study type session type thing. So, it just came to my mind. So being and having the opportunity of being a nurse, you come against so many different diseases and illness in the hospital or in the nursing homes or home health, wherever you may be working as a nurse or a CNA, wherever or whatever you may be doing, you have the experience to come across different diseases. And one thing that really stuck out to me was I had a patient who was very young, and this patient had to be like 20, in his early 20s. And this patient had HIV/AIDS at a young age, and I begin to think, this person hasn't even lived their life yet. And here they are in this situation, in this bed, in this place, and sickness just kind of overtook their bodies at a young age. Here they are having to worry about not being able to breathe, weakness, and debilities, what we call physical debility is another word for weakness. And here I am, and inside of me, it just touched me because it's like when you're young and you made stupid mistakes, God gives you the grace to learn from those mistakes. And you begin to just look and realize and how great God's grace is, that HIV has no name. HIV/AIDS has no name. It has, it doesn't know a name. It just knows that it has to live in the body. And as I began to look at this patient, I had another patient who was very young at a young age. He was also in his 20s. That I just feel like young kids now, and especially like from the age, I would say 12 and up, or from the age that they are able to understand about sex and abstinence and stuff like that, that we should teach our children or teach our nieces and our nephews to be abstinent, to wait into marriage, and it's just, how some people do not have the blessing of being free from that. And so the point of me doing this video today is to hopefully help someone and educate someone about abstinence, about staying away, about not catching HIV/AIDS, what to do to not catch HIV/AIDS, because in those years, you are a teen, you are young, you should be living your life, not worrying, and not to say these patients were worrying, but, one of these patients was worrying. He was a young guy. These were two young guys, and one of the patients I had previously, he was, just calling out for his mom, and it was just sad because you can tell he was in a state of distress. You can tell that he was just like, how did I get here? What did I do? And just hearing people's stories and things, it just made me want to do a video to educate those that if you're in your teenage years in high school, that you don't have to be peer pressured into having sex, unprotected sex, or having sex at all. Just stay abstinent, because one day God is going to send you the person for you, and so if you're listening to this and you may have been in a situation where somebody just told you, oh, I'm clean, I don't got nothing. Do not believe what people say. Take them behind to the clinic. Excuse me, y'all, my phone just fell. And this is not an edited video, so excuse me. So I may just have to hold my phone, but that part will not be edited out. But, don't just believe anything. Don't just follow around, fast girls or fast guys that telling you, oh man, she's bad and she's this and that, and so forth and so on, because you just don't know what the status of what people is. And then you can look on TV and all you see is all these ads about HIV and AIDS, and it's kind of directed towards just almost homosexual black men, but that's not true, because we see it, a lot. We do see it in black men, but we see it in black women. We will see it in Hispanics. We see it in Caucasians, all types of people, Asians. Like I said, it has no name, it has no culture, it has no type of religion. It just knows that it needs to live in a body. And so on this video, I just pray that it touches someone to help somebody, to protect somebody. Okay, so I want to teach you guys some signs that you can recognize. And I'm not saying that a person, by these signs, they have AIDS. Don't go in frantic mode, because that's not what this video is about. But I do want you to understand and know some symptoms from my experiences as a nurse and what I've seen, and just hearing people's testimonies of what they have gone through. I want to educate you guys. So one thing that a lot of times what we were taught in nursing school is that people with HIV/AIDS, they have a compromised immune system. So pretty much what that is that the body has these cells, and they're called white blood cells. And what they do is help our bodies to fight against infection. So when our bodies is under attack, let's just say from HIV/AIDS, the flu, let's just say any kind of sickness in our bodies, our cells are being attacked by these different bacteria or organisms in the body, okay? So what happens is typically a normal white blood cell count ranges, depending on where you are, is usually anywhere between 5,000 to, we'll say 11,000. We were taught 5,000 to 10,000, but depending on where you are, it could range. So with the white blood cell count, we keep a look at those things. If it drops below 5,000, then that person is more at risk for being immunocompromised, meaning they're at risk for being or having infections or getting more infections. Now, one main thing I do want to teach you guys is that HIV/AIDS has similar symptoms as the flu. Okay, so think about the flu. The flu, you have like fever, you have chills, you have body aches, things with the flu is usually sometimes seen with people who have HIV/AIDS. Now, I'm not saying if you having those symptoms, you have HIV/AIDS. I'm just saying those are things that are common symptoms with HIV/AIDS, because a lot of people will complain, well, I had those symptoms and they didn't have the flu, they had AIDS. So those are just some common symptoms that you may see. So these people with HIV/AIDS, they also have more risk of getting, like I said, other infections such as tuberculosis, pneumonia. So most people with HIV/AIDS, they have like recurrent pneumonia. They may be healed and they get it again. because they have the diagnosis, like I said, because their body is so weak, they can't fight off any infections, so they're at risk for more infections. Another thing that I would say as a nurse that you should do is make sure that you're checking your lymph nodes. So checking your lymph nodes are in the size of your neck, and then in your armpits, you want to check for swollen lymph nodes. It's kind of like this big lump that you may feel. So check for lymph nodes, different things like that. Patients may complain of like yeast in their mouth, so it can cause yeast in their mouth or yeast in their perineal area or their genital area as well. With yeast infections, there may be like an itching or something like that. And yeast infections can show up like in urinary tract infections as well, or if you're taking antibiotics, it can cause yeast infections as well. So that's just another nursing tip for females. If you do have a UTI, a lot of times doctors will put you on what they call diflucan, and it helps to treat yeast infections for women who have UTIs. And so the most definitely way to avoid HIV/AIDS is also to stay abstinent, right? To not have sex at all. And that's the main way. And I feel like sometimes, you know, we got to be educating ourselves to be able to educate somebody else, right? And it's something that's kind of shied away from. Nobody really wants to talk about it. You know, that's a very sensitive topic, but it has to be talked about, because how will people know? How will people be informed if nobody talks about it? If people shy away from it, how would we know? So we have to kind of put ourselves in the forefront and be able to reach out to other people, because I want you guys, if you're young, I want you guys to be protected. I want you guys to have long, healthy lives. Live healthy. You shouldn't have to be confined to a hospital bed. You shouldn't have to be confined to all these medications, because this stuff is real, y'all. These medications you see that these people are advertising, and this stuff is real. People are taking these medications, but they're not telling you, or they're not showing you. They're just showing you what the medication is and what the medication can treat, but they're not showing you this patient in this bed, or this patient is weak and about to fall and can't get up. This patient is starving. This patient is so thin that their body is so frail that, you know, it's like almost between a situation of life and death. They're not telling you these things. They're not showing you these things. They're just telling you, okay, if you get this medication here, you can prevent HIV/AIDS, but they're not telling you the full truth that the only way to prevent HIV/AIDS is to not have sex at all, is to be abstinence. There is no such medication in the world that can fully prevent you from getting HIV/AIDS. The only way is abstinence. So be careful. Be hip to the society that we live in. You know, be, always ask God, always, as a female, always take care of your body. As a man, take care of your body. Get annual checks. Make sure your body is healthy. And just make sure that you have the mindset to want to be healthy. You're not just going around and laying with this man or this woman and then distrusting that, okay, they're clean because they say they're clean. But no, you guys. So I just want to get on here and speak to you guys about that. Just knowing that the only true way to identify if a person truly has it is to get tested for it. And a lot of clinics, we don't really see it a lot done in the hospitals, but they can do it in the hospitals as well. But a lot of clinics do it and stuff like that. So I just want to hop on here and talk to you guys. I just pray that this video helps you. This is not a video to scare you. This is definitely not one of those videos, but this is a video to help, to warn you and to educate you, just to be careful, and just to wait. If you're a woman, if you're a man, do not be peer pressured to rush into things. Just wait, live your life, and be happy. I love you guys. All right.